Hello and welcome back. So I'm going to talk about the cranial classes I've taken. So first of all, you start off with Cranial 1, which is Craniosacral Therapy 1. It teaches assessment of the central nervous system and fascia for the full body treatment protocol, which means we're giving a protocol, or we are given, depending on if I talk out of the TA's point of view or when I was a student. It's a 10-step protocol, and it helps to assess and release the full body. So this is supposed to give the therapist a tool. So usually it's a PT, massage therapist, doctor, can be anybody who has a hands-on license. I think Cranial 1 you can still attend even if you're a lay person, just because you're curious about craniosacral therapy. But then to advance to Cranial 2 or the other classes, you need to have a hands-on license, because obviously you're manipulating, even though it's indirect most of the time. I mean, it's indirect technique. So direct means thrusting and adjusting, like what the chiropractor does. Indirect is it's gentle holds, but we're still releasing the fascia and we're releasing certain restrictions. So that's Cranial 1. There's a book. I think it's more interesting for the student of craniosacral therapy, not necessarily for the lay person. I mean, it's a thick book. It talks about craniosacral therapy. And then the next course would be Craniosacral Therapy 2, which is moving beyond the dura as in the dura mater, spinal cord, central nervous system, moving beyond the dura and assessing acute and chronic conditions and the mouthwork protocol. So we are teaching the arcing, and so you can assess. We're teaching the student how to assess where in the body is the restriction. So it becomes a little bit more interesting. That's why, as when I was saying, can't believe that someone only takes Cranial 1. It's like, okay, if that's all they want, fine. Or maybe they don't get it. But I always think adult learning, or if there's something to learn, maybe it's just me, it's like, just see how far you can go with it. There's always something to learn. There's always something exciting. And also you get the treatment yourself. So yeah, you have lecture, and it's a lot of lecture. People just think, oh, craniosacral therapy is just like, we just put the hands on the body, kind of like Reiki, like, don't know anatomy. It's like, no, it is anatomy intense. And sometimes students really get overwhelmed because they thought, oh, this is easy, I can do it, but it's not energy work. That's what people don't understand. So Cranial 2, again, there's a book. I think it's more interesting for therapists to take the class. It's called Craniosacral Therapy 2, Beyond the Dura, written by Dr. Upledger. And another part of the Cranial 2 class that I think is very important is the mouthwork. Not enough therapists do the mouthwork, which is very gentle. We have a glove on our hand. There's nothing. It's all clean, and it's not yanking anything, but balancing restrictions. I, as a therapist, always, except for if someone is like really sensitive, or can't open their mouth, and that usually applies more to clients who are on the spectrum. I won't, and even though some of them I can treat from inside the mouth and some not, and that's fine, but everybody else, I treat you from inside your mouth, because if I do not balance what needs to be balanced, I'm not going to go into the details since I'm not teaching cranial class in these videos. If I do not address the restriction within the mouth, nothing is going to hold. Or you will have headaches or weird experience of twitching and other things going on. So again, for the therapist, if there's any therapist who's watching this video, it's very important. Always integrate the mouthwork, at least in the first session, just to get things out of the way. It's really good. Trust me, I've been doing this for many years. Okay, so then we go on to the next video where I'm going to talk about the somato-emotional release classes. Thank you for listening.